Written at the dawn of contemporary mass illegal drug markets, the Commission's chapter on narcotics and drug abuse identified drug and crime problems of the last 50 years. Though drugs of abuse and responses to them have changed over time, much of what was written half a century ago is still relevant today. In fact, last year's Presidential Commission on Combating Drug Addiction and the Opioid Crisis echoes several findings. The drug scene of the mid-1960s was dominated by heroin in a few cities, rising cannabis use amongst the young, a modest concern of diverted prescription drugs, and the emergence of new hallucinogens like LSD. Until then, the 50-year-old policy of prohibition seemed to work, in that drug use was uncommon. Law enforcement wasn't preoccupied with prosecuting drug offenders, incarceration rates were low, and drug marketplace violence was practically non-existent. In short, there was little reason to be concerned with the harms of enforcing criminal prohibition, such as over-incarceration or the deterioration of police-community relationships. The response was to seize product, and success was gauged by price and availability. To that end, the Commission recommended bringing new chemicals under control and increasing enforcement capacity to stem the importation and distribution of illicit drugs. It's all right. It was thought these supply-side efforts, coupled with the advent of new medication-assisted therapies like methadone, would reverse rising drug use. The image of a modest and seemingly manageable drug problem was soon upended by the social and cultural changes of the late 1960s and early 1970s. Cannabis use continued to rise throughout the 1970s, while heroin use peaked at around 1975. New drugs like crack cocaine would emerge and generate considerable marketplace violence, dominating law enforcement attention in the 1980s. Synthetic stimulants, particularly methamphetamine, preoccupied drug policy discussions in the 1990s. And since the 2000s, we have found ourselves once again facing a prescription drug problem that is now transforming into a crisis with the arrival of potent synthetic opioids. The immediate and unforeseen shifts in drug consumption illustrated by the 1967 Summer of Love and the ensuing drug epidemics and their attendant problems I just outlined shows that the commissioners failed to foresee the problems facing the country. Indeed, it's hard to predict the impact cultural changes would have on attitudes towards drugs. Yet the Commission's chapter rings true still today. The public remains concerned about many of the same problems. Acquisitive crime contributes to fear and frustration, and the number of lives lost to addiction and overdose still cause for alarm. Moreover, the Commission maintained a nuanced and underappreciated understanding of the problem. Long before the repeal of marijuana prohibition in states, the Commission would question the appropriateness of the drug scheduling. Decades before the advent of the U.S. Sentencing Commission, the passage of harsh punishments, or debates surrounding sentencing disparity, the Commission would question the utility of mandatory minimums and the restrictions on judicial discretion for drug-related crimes. The Commissioners recognized the limits of law enforcement in reducing illicit drug trafficking and distribution, expecting that methadone and other treatments could reduce demand and the overall magnitude of the drug problem. The Commission's affirmation of treating rather than punishing chronic drug users and a more nuanced understanding of the complex socio-environmental factors that feed into addiction is just as relevant today. The chapter's frank criticism of legal barriers to researching alternative maintenance therapies is important and overlooked. Unfortunately, many of these barriers remain. The evolution of the problem from one of drugs to one of drugs and crime would dominate policy design starting in the 1980s. For almost 30 years, law enforcement would be the principal mechanism with which to address the problem. This contributed to a massive increase in the number of incarcerated drug offenders in both jails and prisons, from some 50,000 in 1980 to about 500,000 in 2010. That said, the federal government is not the dominant player with respect to drug law enforcement, accounting for about 30% of drug incarcerations. Until about 2005, states similarly emphasized enforcement, regularly enhancing criminal penalties for drug offenses. Only at the dawn of the 21st century, when the problem was no longer visibly worsening, was there room to discuss alternative approaches, such as drug courts, diversion programs, or even relaxing criminal penalties. Yet this trend may not last, as states have started increasing mandatory minimums for fentanyl-related crimes. The limited research on supply-side efforts is mixed. Most studies report no effect. In fact, purity-adjusted prices for most street drugs have declined substantially, by about 80% in the case of heroin. Research also points to some unintended negative consequences of drug enforcement. For example, tougher enforcement may increase violence in the drug trade, and it also redirects resources away from enforcing other crimes. It has also contributed to troubling racial disparities in drug arrests. Empirical evidence shows that source country interventions have had minimal prospect and will have minimal prospect in reducing America's problem with either cocaine or heroin. Nevertheless, criminologists have studied other aspects of drug enforcement, identifying potentially successful policies. One intervention to suppress drug markets as a source of violence involves community-oriented approach of carrots and sticks. Likewise, mandated desistance interventions for drug-involved offenders that employ swift, certain, and fair sanctions combined with random drug screens have shown promising results. Research on drug courts, an intervention spotlighted by last year's presidential commission, has benefited some. However, drug courts are expensive and limit eligibility criteria, often excluding the most problematic cases. Some even deny medication-assisted therapies. Taking them to scale would require fundamental design changes and a substantial injection of public resources. Looking ahead, a 2019 commission would build off of its predecessors, both the 1967 report and the presidential opioid report from last year. The latter emphasized public health with only a minor focus on law enforcement. Law enforcement can have a substantial effect on drug markets and drug use. It's often the tip of the spear when it comes to addressing problematic drug and alcohol use. Regardless of a drug's legality, there will always be need for law enforcement to stop a motorist impaired by alcohol or marijuana, reverse a public opioid overdose, or prosecute violent drug retailers. The arrival of synthetic opioids into the illicit markets is stretching the limits of policy interventions. A 2019 commission should research the impacts of prescription drug controls, the efficacy of providing naloxone to law enforcement, and research increased interdiction and detection efforts while promoting innovative demand reduction efforts. Channeling the 1967 report, a future commission should reiterate the importance of medication-assisted therapies and identify limits to maintenance treatments. In the face of a drug epidemic not witnessed since over 100 years, a future commission should call for additional medication therapies. The harm stemming from synthetic opioids in today's street markets makes maintenance therapies more attractive. Research on alternatives like hydromorphone or diacetylmorphine have shown significant and positive effects when compared to methadone, including early desistance from use of illicit drugs and criminal activity. Effective maintenance therapies can reduce both criminogenic drug use while attracting drug users into treatment. However, legal and political barriers remain. A future commission that is balanced and authoritative could shift public discourse, opening new avenues for research and policy design to manage our ever-evolving drug problem. Thank you.